Well, here I am back on the road. I'm in the town of Utica, New York. There's a Utica Islamic Center right across from the American Legion office, next to an old time bar that I think has been closed for a number of years. Why am I in Utica? Well, I'm here for some work that I think is critically important, which is around helping to connect peer-based resources into emergency departments and hospital settings. How can people with lived experience change the trajectory of people who have substance use disorder or people who have a mental health condition? And the peer is an advocate, an ambassador, similar to the work that we're doing with Inez around taking peers and using them as guides. That's part of the work that I'm doing here for the Center for Social Innovation with my colleague Livia Davis. But I think what I found, you run these streets and these communities, and the pain, the poverty, it's deep. It's really deep. And it's hard to know how any one solution, any one intervention can change this. And where do we go from here when the world around us almost seems like it's crumbling? I think there's a lot of places to go. Wherever we go, if we go together and we create the kind of solutions that are person-centered and community-focused, we can create lasting, truly lasting change. But there's no easy solution, and it's going to take a lot of really powerful effort. And it's going to take a lot of collaboration. Hi. Well, it's been a number of weeks since I've filmed one of these blog updates, and it's not been without a fair amount of activity happening in the world. I am very mindful to how overwhelmingly complex our lives have become about media. And so the last thing we want to do is provide even more media updates unless they're meaningful levels of updates. So with that, we've been very cautious in getting things out. But one of the things that we've realized is that there's a need to stand up in the world. There's an overload in our world at this time, and it can almost feel overwhelming. I heard someone say that they were feeling compassion fatigue. It can make us exhausted. But our world is not standing still. We cannot stand on the sidelines and expect that things will right themselves. We must be involved. We recently suspended a fundraising campaign, a campaign that we had started this summer to help to advance a couple of our key programs. And the reason why we did that is there are real threats happening right now. Physical threats like the superstorms that are in Florida and the Caribbean, like the earthquake in Mexico, like the tremendous flooding that's happening in Nepal and Burma, northern India. And we feel like it's really ethical for us to say these are pressing needs. And so we've asked our supporters, please, we are asking you to suspend any giving that you would give to HBI and to give to these worthy organizations that are bringing relief and bringing ongoing supportive services to the communities impacted by natural disasters. And also the tremendous need that occurs right here in this country with some of the discourse that's happening in our society. And so HBI has asked supporters to consider how they can be more involved in those efforts financially, how they can be more involved through volunteer activities.
And that's not to say that we don't have need. We as an organization most certainly have need, but we recognize that these are very pressing needs, and we're encouraging our stakeholders to be involved that way. I'm reminded at this time in particular of a prayer of St. Francis. Lord, make us instruments of your peace. Where there is hatred, let us sow love. Where there is injury, pardon. Where there is discord, union. Where there is doubt, faith. Where there is despair, hope. Where there is darkness, light. Where there is sadness, joy. Grant that we may not so much seek to be consoled as to console, to be understood as to understand, to be loved as to love. For it is giving that we receive, it is pardoning that we are pardoned, and it is dying that we are born to eternal life.